about 4 things I want to talk to you about really quickly, and just how to manage some of these injuries. The hardest one will make last, and that's removing a helmet. So I'll show you that.
Everyone, please be quiet.
How many have we got? We've got 1, 2, 3, 4. Rebecca 5, 6. John. All right. We're gonna practice stuff. I got 11. So we got. There we go. I got 11 of these. John.
I just had a safety course at work, so.
What else we got? Okay. Anybody else?
Ruth will take one.
Okay.
Oh, sorry, I was gonna steal it.
All right. And I got one for John. All right. Number 1 injury in motorcycling is going to be your collarbone. And one more. So this is called a triangle bandage. John, I'm going to steal yours. I need one. Yep. All right, this is a triangle bandage. So if you take this out, this is very aptly named because it's in the shape of a triangle. Your basic med kit that you buy on Amazon will have this. Okay? So imagine Heather broke her right arm, her collarbone right here. Okay, so this is where her injury is. When you look at this, you can see her. Sorry, I'm just putting your bra. Heather wears a bra. So you will be able to see damage. It'll either be coming out, that's an exposed fracture, or you can see it manipulated here. She will be very sad. Okay, the position of comfort is this. And the reason, and what she'll be doing, these people that injure they'll grab their shirt and they'll hold their shirt because it takes the pressure off of that joint and they'll get relief. Okay, so with our triangle bandage, I want to create a way for that to release the pressure off of that. Okay, so the first thing you're gonna do is you're gonna take your triangle long ways like this, and you're gonna have this middle end. You're gonna tie a knot.
Do you want us to do
Yeah,
this
you can
or
do
just
it.
watch?
Yeah, you can do it. So tie a knot. You can do this on the person next to you, whatever you want to do. There's my knot. Does that make sense?
Mm-hmm.
So yeah, you got so hold it long ways, and then that right there, tie your knot. Okay? Then I'm gonna take this, and that knot is gonna go where her elbow is. I'm gonna switch this in like this,
Give me your elbow.
All right.
Get rid of your
and
glass.
see how that knot holds it right there? And I'm just gonna tie it.
Does it?
And from here, depending on how the length of, your hair's,
Little arm that has the elbow in your.
there you go. And once I tie that takes all that pressure off of there.
Yep.
Now, if this isn't working very well, you don't tie a very good knot, she's not getting a lot of relief, guess what you're gonna do?
Duct tape.
Duct tape that crap right on there. Do it. Duct tape your wife. So rip it around there,
It's this way.
and once it's duct taped, they will cut it off in the hospital, doesn't matter.
Yeah, it's like that.
Davis,
Is that holding
when
it?
you have
Yes.
an injury like this,
Yeah.
that come on an accident scene like that, are people generally calm, or like, do you run into situations where they're like out of control?
Genuinely,
and you can't do that.
Yeah, genuinely the patient is calm.
That's why you-
Genuinely the bystanders around are chaotic. That's why I say give people a job.
Yeah.
Go call 911. You manage traffic. You stay with the patient. You give people something to do. Okay? But if you want to practice, you guys.
This way.
Yeah. So you're gonna do. Let's see your knot. Yep. Got it.
Heather, do you want him to use
So
the
take
duct tape to
like
repair
that,
your broken saddlebag
and then go around it like that.
or put you back together?
Put me back together, sir.
All right. Any questions on the triangle bandage? Tie a knot in the center one. Wrap it around. If that doesn't work, you can duct tape it, or you can do both. You can duct tape both. Okay, I don't care. Nobody does. If you're worried about how hard you duct tape somebody, how hard you bandage somebody, how hard you splint somebody, you can check for fusion by cap refill. Everyone can do that. If you look at your fingernail bed, if I squeeze it, it turns white and then goes back to that kind of purplish color. If that doesn't return to its normal color within 2 seconds, your bandage, splint, whatever you did is too tight. Okay, it's called cap refill, or capillary refill. Right? All right. Any questions on triangle bandages? Good. This, you can take that off.
Okay.
This is a SAM splint. This is the coolest thing ever. The reason I didn't pull one out of my med kit is they never go back in the way the same. Okay, it's like electronics you buy on Amazon. Okay, everyone can feel this. there's a metal pad inside of this. Okay, I don't know if you can. It is shapeable, moldable. Feel the metal in there? It's not on the edges, it's just in there. I don't know if anybody. All right, so I like SAM splints from everything from a broken leg to really an arm. Okay, these are cuttable.
So once you start messing with that, it never gets folded back original, the way it's original?
No, they never work right.
Okay.
Cut it. Okay, once you cut it, you can mold it. You can do whatever you want with this, okay?
Okay.
It's pretty cool. Now, the way I do this, let's say Heather broke her wrist. I'm gonna give her something she can hold on to, okay? There's my bottom. This is gonna hurt. I can shape this any way I want. I can bring it around. She's usually screaming in pain at this point because
So-
I'm manipulating this. And then, there's my splint.
Okay.
All the splint does, whether it's a wrist, yeah, and duct tape.
Mm-hmm.
Duct tape. Your little med kits will have medical tape. I don't care. Whatever. I just want to secure this.
Zip
from-
ties.
Zip ties. Seriously, you could do this with a branch.
What if she's got the bone protruding through the?
Doesn't matter.
Really?
Yeah. Now, what I care about with bone, so if you have an exposed bone, and where you're gonna really see that is tib fib. Okay, you'll hear these motorcycle accidents with tib fib. They'll expose that bone. Bone cuts like glass. So I wanna secure that. So let's say the bone's popping out on the top. Okay, it's like this. Now I'm splitting like this. I'm gonna expose that bone. What I want to do is prevent any movement of that bone. Every time that bone moves, it is sawing at arteries, veins,
yeah.
muscles, tendons. So I am just trying to, and once I secure it, so she breaks a wrist. Once I secure that wrist, this is relief. This feels better because now she's not trying to hold with her own strength that wrist up. Once I lock that in place, same with the leg. Now with the leg, I'll even wrap it around the leg like this. Okay, I'll give that ankle somewhere to go. Okay, so you can shape it any way you want. But if you broke the ankle, I'm gonna go around that bottom of that foot.
And you put it on the outside of your
Yeah.
gear, right?
Yeah. Yeah, now, if I break my ankle, do I want you taking my boot off? You leave me alone.
Yeah.
And we'll talk about tourniquet in a minute, that's a low risk injury. I care a lot more about your breathing, about your mentation. Do you have a brain bleed? Who cares about your ankle? Who cares? Now I'm gonna do this out of relief. So let's say we're all dirt biking out in Belmore, rescue's 30 minutes away. Your ankle's just hanging there, it hurts. I'm gonna do this a favor. I got time to kill. I'll go around that leg, put a splinter on like this, duct tape the crap out of it. Now I can't move that leg.
If it's a leg or an ankle, you still want to go under the heel?
Yeah, I like supporting the foot.
Okay.
Just like I like supporting the wrist. If I just did this, there's nowhere for the hand to grab onto. Okay, so I'm giving that hand something to do. Okay?
And if there's a bone sticking out and you don't press on the bone with the
Nope.
foot?
If the bone's sticking out of the top, let's say it's doing this action, and you're throwing up in your mouth, you're like, oh my God, ugh. Go around the side. Okay, just manipulate this so that bone, it just can't move anymore. And that's what you really care about. I'm just trying to give her relief. And a lot of times you have a broken wrist, and so she's in a SAM splint, or that triangle bandage, do both. And duct tape.
Traction on legs.
In 7 years, no, how did I spend an ambulance? 10 years on an ambulance? I pulled traction twice in 10 years.
Really?
Yeah. Now, motorcycle's a little bit different. Okay, so if you have a front end impact, let's say you go nose, you will be ejected off the bike. What's gonna hit your handlebars?
I know.
So when we pull traction, what he's saying is, let's say I fly off the bike, I hit my leg on a handlebar, the femur, which is the long bone here, is broken. What happens when you break a bone is muscles tense up to protect the bone. That's its whole job, okay? So there is a thought, and it's a good one, that if I broke the femur, go ahead and lay down on the ground. If the femur's broken, what I can do is I can pull that leg and it pulls that bone back in place and gives them immediate relief. The 2 times I did it, both patients were like, oh my God, thank you so much. The problem is, as soon as I let go,
It's back. You got
And-
Muscles pull it back, right?
muscles pull back. And what did I tell you about bones? They cut. So what I don't want is this. Now we had femur traction splints on the trucks that was mechanical. I would put it around your leg and I would crank that out
Yeah.
and it would give them relief. If I'm in the woods somewhere, I'm not messing with it. The other problem with traction is it's great if it's only a femur broken bone.
Yeah.
I don't know what the knee looks like. I don't know what the hip looks like, and I don't know what this ankle looks like when I start pulling on this. Okay, so as a general rule, it's one of those injuries that I'm less concerned about. Okay?
Worry about it when the rescue gets there with the equipment.
How much blood does the human body hold?
Not enough. When you're
16
leaving.
parts or something?
It depends on the alcohol content.
It depends on, so women are 5 liters, men are 6. In theory, that's what you want to go with, okay? So when I say liters, imagine a 2-liter Coke. Men have 3 of those. These are just statistics for you to know. A pelvic fracture has the potential blood loss of 2,500 milliliters or 2.5 liters. You can lose 1/3 of your blood supply through a pelvic fracture. You can lose 2 liters through a femur fracture.
I had both.
They hurt, right?
No, not the femur, this one down.
Tib fib.
Yeah.
Tib fib. The lower bones don't bleed as much as the big ones. These femurs and pelvis, they will bleed and bleed and bleed. You can hold your whole blood supply right here in your abdomen. Okay, that's why these traumatic injuries, you are assessing level of consciousness a lot, because if they start getting confused on you, you need to be very, very concerned, okay? If I have someone that I'm worried about blood loss, I'm gonna elevate their feet. Go ahead and lay down. Put their helmet under the feet. There's a lot of blood from here to the pelvis. Get it back to the core, okay? I don't care about their injuries. If she's going, I don't know my name, I don't know where I'm at, one pupil's all messed up, you gotta get blood back, okay? And these are kind of highly things we're worried about, but I don't wanna teach you like too crazy much stuff, but those are things to think about, okay? So we talked about triangle bandages, we talked about SAM splints, tourniquet, these are cool. Your med kit will have one, okay? It's pretty simple. Heather's got the spindly arms, I'm sorry. I don't know if this is gonna work. All right. Where's Dave? Come here, Dave.
We got plenty of big
My
guys.
former NFL football player friend, Dave. He's got big arms. He's been in the gym. He's ripped. All right. Tourniquet, squirting red blood. You will be able to tell the difference between dark red blood and bright red blood. You will know right away, and it will squirt. Squirt is, it's got a pulse. If I cut my finger and it doesn't pulse out, it's a venous blood, don't even worry about it, okay? If it's squirting blood, I'm concerned. So let's say Dave ripped his hand off, so now he's got no hand. It's just squirting blood out, and you're throwing up, and you're like, oh my God. Ugh. So the way this works is I'm gonna tighten it with the Velcro strap, and then I'm gonna twist and twist and twist until the squirting stops. Pretty simple, okay? This is white so I can write the time. When did I stop perfusion on that arm? When did I do that, okay? A limb can live 3 to 4 hours without perfusion. People get all whacked out about tourniquets. Yeah, I'm all scared. Even if you applied one and they were to the hospital in an hour, once they're to the hospital, they're gonna go to surgery. So many of these patients do not need a bunch of intricate care. They need diesel. That's what they need. You don't, I'm not gonna fix you on Belmont Forest on a Sunday afternoon. You need surgery, and that's how we're gonna fix it. But that's how you apply a tourniquet, right? Open it up, cinch it tight, lock it down, twist until the bleeding stops. Okay? All right, don't do
Downstream of the injury.
upstream from the injury.
Why do they say don't take it off after you put it on?
Are you gonna, well, there's a number of reasons. Well, are you gonna get a good enough tourniquet seal again? And what are you reperfusing? What we're really scared about, I'll be honest with you, there's a bunch of different reasons. Again, we're practicing medicine, is a blood clot. I don't want to coagulate blood downstream, undo the tourniquet, and let that clot flow wherever it wants to go. A clot in the head is a stroke, a clot in the heart is a heart attack, a clot in the lungs is a PE, pulmonary embolism. Okay? So once you apply this, leave it alone, write your time on there, let them deal with it. Okay? All right.
Okay.
Yeah.
Well, we had a memorial ride a few years back going over towards the west side of town about a guy who was a heavy core rider, used to do all kinds of things. He had an accident on one of the rides a few years previous and actually lost both legs on the ride. They used belts and they were able
Yep.
to stop and save his life. A few years later, artificial legs, he's riding again.
Yeah. I mean, and again, these are the things that when John asked me, what should my med kits have? Triangle bandage, SAM splint. A lot of your med kits don't come with SAM splints, and I love these things. Tourniquet, trauma shears.
Can
This
you
will solve.
just buy a SAM splint in a pharmacy?
You can.
I mean, is it?
Yeah, you
they're
can.
there? Okay.
Yeah, I think they're there. They're called SAM splints. I just get them on Amazon. All right, last thing. To remove the helmet or to not remove the helmet. I'm super superstitious about helmets touching the ground. They freak me out. Someone told me one time if your helmet touches the ground, it's gonna end up on the ground. You can lay flat. So this is a helmet that we don't use. This is a helmet, Heather's old helmet, so it's allowed to touch the ground, so I'm not freaked out. All right, so I'm gonna just kind of show you really quickly what I would do in an accident. When I went through EMT and paramedic school, what they always taught us is when you are doing a scenario, BSI, scene safety. BSI stands for body substance isolation, so gloves. Your little med kit will have padded gloves in them. I don't trust anybody, okay? I'm assuming everyone has HIV and Hep C, okay? Whenever I don't touch people. I also don't do mouth to mouth as a general rule. You guys are all cool, I hope you all live, but I'm not touching my mouth to mouth, I'm not doing it. So, BSI scene safety. So what I'm looking for is she laying on an electrical cord? Is she laying in a pool of gasoline from the bike? Is she laying in the middle of I-95 and traffic's buzzing around her? Okay, that's my first thing because I don't want one patient to become two. If I'm concerned about the scene, nothing trumps that. I will grab her by her jacket and pull her to the shoulder of the road. I don't care about C-spine. I don't care about anything. All I care about is I don't want her to die by another car or whatever it is, and I don't want to get hurt. Fair? Okay, so now I've established that my scene is safe. I'm gonna go up. Hey, you okay?
Nope.
No, that's bad. That's bad. She's not responding. Okay, I can kind of poke at her, wake her up. She kind of wakes up. I'm gonna ask her what her name is. Do you know where you are? Okay, so she's confused. We got a problem. I'm gonna hold C-spine. This is it. Don't let her move her head. It's pretty simple. Okay, don't let her move her head. Normally this would be closed. I'm looking at her teeth. I'm looking at her mouth. You can even pull her mouth open. I just want to take a look and make sure there's nothing obstructing the airway. If this helmet is causing her head to be like this, it's time to take the helmet off. She can't breathe very well. They'll teach you with babies. They have huge heads. I don't know, anybody giving birth here? I haven't given birth, but the head's the worst part, right? It's because kids have this abnormally obnoxious sized head. And when they lay flat, they lay like this and they can obstruct their airway. Helmets do the same thing. But right now, I'm pretty happy with this. I'm not gonna mess with it. I'm gonna give people jobs. Call 911. Go stop traffic, okay? That crowd, that church bus over there, can you just tell them to stand over there? We're good, I got it. Make sure you're controlling the scene, okay? Let's say I'm not happy with this, so now I need to get a volunteer. I need somebody. Dave, scoot this way. How's your knees? Am I gonna hurt you if you're on your knees? Okay. So Dave's my buddy. He's gonna come help me. I'm glad I got the help. I want you to go to her head and just kind of hold her head like what I was doing. You can get on both knees. You can do whatever you want to do. If I had to remove this helmet, this is nice because it's a modular helmet. If it was closed, it'd be the same process. I would love to be able to take these cheek pads out. The newer helmets have little red tabs. Pull the tab, cheek pad comes out. It's brilliant. Cheaper helmets don't have them. This is a cheap Sedici. Ain't got it. Okay? I know. And you're gonna see why I hate taking helmets off. I'm gonna move that helmet out, and I'm gonna hold her face and her neck. Dave, I want you to take your thumbs and spread open the helmet and pull it off.
Oh, it works.
Okay.
See how I held the head? Did her neck move?
No.
Okay, we're good. I'm gonna hold her C-spine right here. Let's say she starts throwing, okay, Dave, we're good. I made you suffer long enough.
Her face is turning red. Is that a problem?
Says, don't hold her like this. This is a problem.
He squeezed hard.
Nothing about, you go and stay right there. Nothing about care is dainty. You do not want CPR from me. You're going to get a heartbeat back and you're going to hate life. I'm going to break everything right here when I do CPR. I'm going to break it. Okay, it feels like broken glass in there. If I'm taking your helmet off, I'm going to hold your face so tight, you think I would have punched you in the face. Because I don't want that neck to move. Okay? But let's say, who's limber? Who wants to be?
This age.
Yeah, hey, John, you want to? I'm going to pick on John because he's the president. Come on over, John.
Yeah, good. He needs to be picked on.
All right. So, John, hold her head. You're holding C-spine. Okay? I'm really concerned about her. You're doing the whole thing. Lay your feet flat. She starts to throw up, or she starts to get blood in her mouth, or that airway starts to get real ugly. I want to get her on her side. This is called a log roll. 2 people can do it. I prefer 3. John is in control. What he's going to do is he's going to count to 3, and we're going to roll towards me.
1, 2, 3.
Feel free to throw up.
Okay.
Feel free to bleed. And then we're done. Count.
1, 2, 3. Down.
And the third person would be on the legs?
Mm-hmm. And again, do I care about the legs?
No.
Do I care about a broken ankle at this point?
No.
Blood looks really scary. When you look at a gallon of milk, which is
1 gallon.
a lot, it's a gallon. It's basically 4 liters. 3.92 liters is a gallon of gas. But half of that, if I took a half a gallon of milk and I threw it on the floor right now, what would that look like? It'd be huge. People get all caught up about a pool of blood this big. That's nothing. Don't get distracted by that injury. Don't. Monitor the airway. Watch out for their neck. And then protect yourself. Make sure you're not in traffic. Make sure you're not some truck whizzing by you, or, you know, if it's raining, if there's electrical cords down, if there's oil, if the bike is leaking gas and it's flowing down here, get her out.
So if you're gonna drag her off the interstate to the side,
Yeah.
would you grab her up
Yeah.
here?
Yeah.
Just by the jacket, right?
If
Not
she had
under the
her-
arms?
Do me a favor, put your helmet and jacket on.
Yeah, what if she didn't have a jacket? She was being
What if you're a
stupid,
Harley
riding-
rider?
Yeah, riding in a t-shirt.
She's wearing
Or
her,
a tank
she's got a
top.
thong and chaps.
Well, if you didn't wear any gear, go and grab your jacket too, real quick. If you didn't wear any gear,
You're a donor.
you do. No, I'm just kidding. I don't care. What I'm gonna do, again, you can't tell with injuries, you just don't know, but if this is, so first off, none of this is ideal, right? We're on 17, there's a bunch of traffic, she's in the middle of the road, nobody's here yet, I'm scared, she's unconscious. What I'm gonna do is yeah, what I'll do is I'll grab, but I'm gonna hold that head.
Okay.
I'll grab underneath that. Now, am I gonna hurt myself? Yeah. Am I really a big fan of hurting myself to pull this person who, no. Ideally, I wanna control my scene, but if bike is on fire, it's leaking gas, there's a bomb over there, like the worst possible thing ever. Get up underneath her, and I'm gonna hold that head.
Oh, I see with their arms.
Now, what if she says, oh, I think I'm fine, but you told us probably not fine.
That's cool.
Do you just say,
I tell you
stay
what,
there?
yeah,
don't get
dude,
up?
I think you're probably fine too, but let's just do the right thing here.
Just-
EMS is 5 minutes away. I'm just gonna hang out with you. It's cool that you're all right? But tell me your name. Do you know where you're at right now? Who's the president? Okay, how many kids do you have? What do you do for work? That's cool, keep you busy. Okay, distraction. One of the things I used to do in the OR, you roll into the OR before you go to sleep. There's 5 people running around, bright lights, it's scary as crap. You hear your monitor going off, and everyone's quiet. You're going, this sucks, I'm about to have surgery. I come up to you and go, hey, what do you do for work? How many kids you got? Oh, I do this, and I'm a furniture salesman, and blah, 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 and then all of a sudden they're asleep. So distraction is everything. Keep them distracted, and don't let 20 people crowd you. That church van, get them away from you. Hey man, can you go stop traffic for me, or can you guys back up for real quick? Control your scene, it's everything. That make sense? Any questions?
Perfect.
That was
Yes.
One thing, go ahead. A lot of times, a third party has something to do with this incident. When in your hierarchy, do you have somebody maybe identify the
Yeah.
car that maybe caused the accident?
So we do something called trauma control or trauma. We monitor patients. It's called a mass casualty event. Okay, so these are always awful and they're always terrible, and you don't want one. But essentially, what we got to do here is a super healthy female, 110-pound person that I can move and manipulate, and it's great, and everything's controlled. If a church van rolls over and there's 25 bodies there, you have a huge problem. My ambulance could take 2. That's what I can bring to the hospitals, 2. So one of the questions when you call 911 is going to be, how many people have you got there? Okay, because if you had a group ride and 10 people went down and they're all unconscious, they need to send extra resources, okay? At that point in a mass casualty event, we go green, yellow, red, black. Green is walking wounded. You can take yourself to the hospital, buck up a little camper, you'll be fine. Yellow is your injuries are pretty severe, but you don't have to get to the hospital right now. Maybe you got a broken wrist, maybe you got a broken leg. You're gonna survive. It's just bad, you're probably gonna need surgery. Red is you have a head wound and you're bleeding, but you're talking, okay? Or your whole side is mangled and you're talking. Black is you're not gonna make it. You're not gonna make it with the amount of resources that we have. You may be breathing, but your head is caved in, and even if I got you to the hospital, the chances of you making it are low. So I'm gonna choose the red over that. Does that make sense?
But I
Yeah.
think the question was,
Yeah,
the guy who turned into the bike and took
We're
the bike
stopped-
down,
we're stopped at
what
a
do you
traffic
do about
light.
him?
Yeah, we're stopped at a traffic light and somebody hits the last bike in the group.
Okay.
Whether it's 2 bikes or 20 bikes.
Yeah.
When you're assigning jobs, I mean, someone's gotta take charge,
Yeah.
give assignments. At what point do we identify the alleged perpetrator of the accident to get their license plate or?
I think you assign that as a role, just like you'd assign it, call 911.
Okay.
Yeah.
But if the accident was caused by somebody, caused by another party, outside of our group,
Yeah.
it seemed to be kind of important to make sure that person is
Yeah.
identified or a
Thank you.
license plate or something like
Yeah,
that.
yeah. I mean, those are things. So I'm gonna attend to the patient. I'll tell Rebecca, hey man, go see what's going on with them. Go get their license plate. Go see if they're okay. Like, nah, whatever. But priority for me
Nowadays,
is,
the driver, if it's
Yeah.
a car, I mean, they may not stick around.
and again, the motorcycle might be okay, and that driver took an airbag to the face. I can't tell you how many people I drive past and their legs are up on the dashboard. Have you ever seen injuries from an airbag deployment with their legs on the dashboard?
No.
It will fold you like a pretzel. It'll break your pelvis and break both femurs, and it will kick your legs behind your head. And it's unbelievable. I can't tell you how many of those I've seen in the ER, and they will shock you. And these 12-year-old girls got their feet up, and they're on the phone, and you wear your seatbelt all day long, you're gonna be a pretzel in about 2 minutes. So you'd be surprised that motorcycles could be hit and the driver of the car is in a mess.
You did in the supine position.
Yeah.
Is there any reason when someone's face down?
Never.
To roll them?
Uh-uh.
Even
Just-
just to turn their head to get a better, if they can't
So,
breathe?
and now we're asking CPR questions. I am not gonna put my mouth to your mouth.
No,
I'm
no,
just not.
I mean,
but-
no, I mean, if a person's lying face down,
Oh, I'm gonna roll them over,
yeah, why would you roll them over?
because I want access to their airway.
Okay.
Every time. I want access to their
We
airway.
did this several years ago where the assistant did the cross-hand thing.
Yeah,
And they rolled them over.
yeah.
Okay.
Yeah, just like the log roll, you're gonna have 2 people on the side of the body, and the person at the head is always in charge. And that person at the head's gonna count it off, and you guys are gonna roll and roll. Okay, but I wanna see their face, I wanna see their pupils, I wanna see their airway, I wanna see all the stuff. And if you're laying on your stomach, you're having a hard time breathing,
Yeah.
because there's pressure on your lungs too. So I wanna see what's going on. So, yeah.
And we had one more thing, we had a lady from UF trauma people gave us Narcan.
Oh, yeah, that's cool. You know what that's for?
Yeah.
Okay.
Fentanyl.
Addiction.
Opioid overdose, any kind of opioid. So oxycodone, hydrocodone, My part-time job is I'm pain management, so I just dish this stuff out all day. It's great. Fentanyl and methadone and blah, blah, blah. So yeah, opioid. So what's your telltale sign on opioid overdose?
Not breathing?
Forgotten.
Pinpoint pupils and confusion. When you look at their pupils, it'll be like a little tiny dot. If it looks, you're looking at that, that's weird, that's opioids. Okay, and Narcan's great. It's fine. Fun fact, low dose Narcan boosts endorphins. I take it every day, it's great. It's fun. It's a little tiny pill, just take it in little minute, and they're finding Narcan is this miracle drug that helps your endorphins, it helps energy, it helps you feel better, it's wonderful. Any other questions?
Yeah, we had another nurse came in and gave us kits on, for stop bleeding.
Yeah,
And actually, the kit she was handing out, I took them to work with me and they ended up using one last week.
Yeah, stop.
The guy got cut.
Quick clot.
He said it's amazing how it worked. It was just like boom.
yeah, quick clot's
So I
okay.
always put one of those in,
Yeah, if they're bleeding so much that I'm worried about it, I'm gonna tourniquet.
yeah.
And then the quick clot's okay. I'm not yeah, I'm good. Again, if they're bleeding so much that you've got quick clot as an issue, what mechanism of injury caused that bleed? Okay, so if you hit something so hard, now you're probably injured your neck. So if I see that, I'm already going, hey man, I need to work on that neck and make sure I'm holding that neck, C-spine. And again, hopefully you're fine. But I've had many incidents where I've gotten them to the hospital and they're not fine. That neck is, and doing surgery for so long, I've done so many of these AC deaths, I've done thousands of them, and you'd be surprised how narrow and tiny that window is of an injury in there. It'll jack you up for life.
What I was wondering was, how does that affect them taking care of you afterwards if somebody has put that on you in an accident scene? Is that gonna affect them clean up? Or
You always worry
whatever?
about clots.
Okay.
Clots are I'm always scared of clots. A lot of men over 60 are on Eliquis. I don't know if anybody's on Eliquis. Yeah, not to expose you on Eliquis, but yeah, you can tell right away they'll have bruised arms. People on Eliquis. It's because they get clots. So a lot of the quick clot stuff, in the back of my mind, I'm always like, I don't want to cause a clot. It's super remote that you could. Again, Good Samaritan laws. You will not, please don't be scared to help somebody. You will not, you're okay. Anything else?
Davis, thank you so much.
Oh, my
I think
pleasure.
This was awesome.
Thank you, I appreciate that.
Absolutely awesome.
Thanks, John, I appreciate it.